Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Hello and welcome back to Between Two White Coats. I have my buddy Michael here today, one of our nurse practitioners. Amber has run off to chaperone a field trip of a bunch of 8th graders that have gone to DC. So we are so happy to be here and praying for Amber that all goes well with a bunch of 8th graders on a bus on her way back from DC. So Michael is here, and Michael is one of our nurse practitioners who has done immense work with me in the world of weight loss and establishing our weight loss programs. And we're going to talk about something today that I think is a question that a lot of people would like an answer to. It's become so common to take these weight loss medications, semaglutide, tirzepatide, the Wegovy's and the Zepbounds, and people want to know, do I have to stay on this forever? What happens if I stop taking it? And kind of a loaded question, as if there's a one-size-fits-all answer. But Michael, do they have to stay on these expensive medicines forever?
I'm going to give a very political answer. It depends. So, you know, it depends on, and we talked earlier, this is why you go and even if you're using these medications strictly for weight loss, there's no issues with your blood sugar and there's no risk of heart disease and things like that. It is always better to find, these programs that are using these medications that are clinically supervised. But it is one of the most common questions I get, do I have to take this forever? My general answer at the bedside to patients is assuming all things are equal metabolically. So if you were insulin resistant before, we've fixed that through medications, through lifestyle modification. Your thyroid's not out of whack. Your sex hormone levels, so your estrogen, progesterone, testosterone, things like that, are optimized. Then no, you can come off. And we're going to talk about how do we come off of them. Is it cold turkey? Is it tapering down? But no, I tell people all the time, you do not have to take these medications forever.
You do not have to take these medications forever. I would say my answer is exactly the same as yours, 100%. It depends. You gave a much more eloquent answer than what I will. What I will typically say is, if the only thing you did to lose weight is take a drug, and you stop taking the drug, you're probably going to gain your weight back. But if you use the drug to actually help you because you were less hungry, you developed better eating habits, and you did it for months, so this really has become more normal for you. And if you used to really struggle to exercise because you were 80 pounds overweight, but when you got to 30 pounds overweight, you could move and you started moving and you exercise a lot more than you ever have, then I fully believe that you can stop taking these medications and not gain your weight back. Honestly, do you have to take the medicine forever? You don't. You can stop taking the medicine whenever you want to stop taking the medicine. These medicines, you don't have to titrate off of, like you were saying. You don't have to take them in a certain. There's a way that we titrate up the dose of semaglutide and tirzepatide, but you can just cold turkey off of them. The difference when you're not taking it is, people will tell us the food noise comes back. That the way it acts on your brain to make your brain say, you're good. Don't think about food all day. You don't have to obsess over when your next meal is, or should I eat more? Should I not eat more? And it's just this constant internal conversation. Well, if you've had that food noise can come back. So you have to develop skills to be able to work through that. And the hunger can come back. When this was sitting in your stomach and making you feel full and making you release the hormones that make your brain think you're full. It's not doing that when you don't take it. So your hunger can come back. So you have to, work out different things to deal with that. So the effect of the medicine goes away when the medicine goes away. If you've changed your lifestyle, changed your habits, lost your weight, we believe that most people would be able to sustain the lifestyle change without the medicine. Will it be harder? Yeah.
Yeah.
You're going to have the food noise. You're going to have the hunger. You're going to have to work through some of those things, but it's possible. But I also tell people that we have to remember that obesity is not only a chronic progressive disease, but it is also potentially a genetic disease.
Right.
And so who has genetic obesity? We don't know. We haven't isolated out all the genome for this, but they believe that there's about 2,000 genes that may affect people's weight gain and obesity. And so if you are a person who has lost and gained 50 pounds 50 times, if every time you lose, you gain it right back, there's a really solid chance that you may have some genes that contribute to your obesity.
Sure.
And for those people, it probably would be better to stay on the drug to prevent the regain of weight.
Right.
And, you know, really what are we saying is, do you have to stay on this medicine forever? It's perfectly safe to stop it.
Right.
Do you have to stay on this medicine forever to prevent the regain of weight? That's a different question.
Right.
There are studies, so if we kind of lean into the research, which is what we white coats tend to do, there are studies that look at regain upon stopping these prescriptions. They are highly variable. And the more you read them, the more that you see different things.
Yep.
I saw one study, and I probably read about 50 regarding regain of weight after stopping either semaglutide or tirzepatide. And there was one study I saw that 100% of the participants, it wasn't a huge study, but 100% of the participants gained all their weight back.
Okay.
And so, and I thought, well, that is super discouraging.
Yeah.
Now, again, I read about 50 and that was one.
Yeah.
The majority fell into anywhere from 20 to 60%.
60%, that's usually what I've seen.
Regained weight.
Right.
Some people sustained. So they got to a goal weight and they sustained there.
Yeah.
Other people regained a third of their weight.
Right.
Other people regained 2/3 of their weight.
Right.
It looked like about 40% of weight looked to be like a common regain. And from a doctor's perspective, I'm still calling that a win.
Sure.
Because if you lose 10% of your body weight, you greatly reduce your risk of some cardiometabolic diseases.
Sure.
And so if you can keep off 60% of the weight loss that you had, if you can keep off 50% of the weight loss, you are still so much better off. Your joints aren't going to wear out as fast. There's, any weight that you can keep off is going to be a benefit to you and your health.
Yeah.
But we don't want you to regain 50% of the weight that you lost either.
Sure.
So let's talk through a little bit about what do we do to come off of these drugs.
Sure.
So, the question, can you come off the drug? Of course you can come off the drug. You can stop taking it anytime, perfectly safe.
Right.
Will you regain your weight? The studies show that a percent of your weight. Maybe. Yeah. The profound scientific answer to that is maybe.
There's so many variables to, am I going to regain my weight? I mean, you mentioned genetics. It's the food, the activity, those metabolic factors we were talking about earlier. So, when somebody asks me that, that's a very hard question to give a definitive answer to. But those are my favorite visits to do is, how they don't want to go back on the medicine. Okay, well, let's figure that piece out.
Yeah.
And so
we love the people who actually go, I'm willing to do the work.
Right.
I'd like to stay off of this medicine. Because we're willing to help you do the work. Absolutely.
Yeah.
So let's talk about what is required to successfully stop the medicine and not regain the weight.
So I think the first two things that I would talk about with patients are typically the lifestyle stuff first. We talked about labs and things, and making sure there's some other metabolic factors that are in line. But if somebody drops 50 pounds, well, your resting metabolic rate, so how many calories do I need to maintain that weight now, is going to be much different than it was 50 pounds ago.
Yeah.
And so meaning you are going to have to eat less to maintain that new weight. And then activity is the second one. People always talk about caloric expenditure and intake and trying to balance that. And balance is the right word, but I have a lot of patients who come in grossly under eating.
Yeah.
And that can be just as counterproductive when we're talking about your weight and regain of weight and things than that a caloric surplus can be. So those are the first two things I talk about is how to eat and move.
And I think these conversations, I love everything you're saying. I think these conversations start while you're on the medicine.
Absolutely.
Because if you are doing these things all along, you don't have to try to learn and start them because you're now at your goal weight.
Right.
You will first get to your goal weight faster, allowing you to come off of some expensive medicines faster if you are doing the right thing along the way. But you also then will have those habits. But as you say about your resting metabolic rate, I think one of the things that's really important to realize is you burn so many calories at rest.
Right.
And if you burn a low amount of calories at rest, then you can eat very little and gain weight.
Right.
You can burn more at rest if you are made up of muscle and not fat.
Correct.
Everyone needs to know that most forms of weight loss are non-selective weight loss.
Yep.
You just lose.
Right.
This medicine doesn't go to the fat and say, get rid of all the bad visceral fat and keep all the muscle.
Right.
You're losing both.
Right.
If you're just losing 20 pounds in a month on these medicines, you have lost muscle as well as fat. If you can, while you're on this weight loss journey or any weight loss journey, if you can prevent losing muscle, you will be so much better.
Absolutely.
There's a lot of information out there about sarcopenia of semaglutide, sarcopenia of tirzepatide. I don't know that we found some pathophysiology that is happening in our bodies that is making us lose muscle because of this drug, that it's targeting the muscle.
Right.
I think, and again, I can't really find this in the research to say what's causing it. There is muscle loss,
Sure.
and I think it is rapid weight loss. When you have rapid weight loss, whether it's bariatric surgery or drugs that are helping you lose weight faster, you're going to lose muscle.
Yeah.
Unless you are actually doing things to not lose muscle.
Yeah, so I've read a couple studies where it says as much as 30% of the weight that people can lose taking these, semaglutide and tirzepatide can be muscle mass, and you're just trading one problem for others.
Absolutely.
And so that's one of the conversations I'll have with patients is what is adequate protein intake for my, somebody my age, my height, my weight, my gender, things like that. And then a lot of times, no offense, usually it's women. When I tell them to start lifting heavy things, and by heavy, I mean heavy, they look at me like I got three heads. They're like, I don't want to look like a guy. And I'm like, well, you don't eat enough and your testosterone levels aren't high enough to look like a guy.
That's exactly right.
So
you're not going to look like a guy, but you are going to look like a woman who does not have osteoporosis.
Correct.
You're going to look like a woman who can get on the ground and play with their grandchildren,
Absolutely.
no matter how many years that is down the road.
Yeah.
You lose muscle and rapidly from weight loss in your 30s and 40s.
Yep.
Your 60s and 70s are a disaster if you don't go into them with muscle.
And you're going to feel better. I mean, if you've got a good lean foundation, yes, it's going to be more efficient for you to lose weight and things like that. But when somebody has a good lean skeletal muscle mass, you move better, you feel better.
Yeah.
So.
And I will say, and I am so guilty of this. So we have a body composition scanner here, and Michael was witness to my tantrum a few weeks ago. We had a medical provider meeting. I had just done my body comp, and I came in with it, and I was like, I have no muscle mass. I'm going to be on a walker in a year, and I may have over-exaggerated my status, but I was really disappointed in my muscle mass.
Yeah.
And the body composition scanner, the DEXA scanner, is so enlightening to be able to see where you're at. And I was in an okay place for my fat.
Sure.
I was like, okay, I'm not too terrible there, but I have got to build muscle.
Yeah.
But I am super guilty. I am the female who's always trying to lose weight. Like, I've got to keep my weight down. And so I'm a cardio person. When it comes to exercise, it's, am I going to run, or am I going to get on the treadmill, or am I going to do this HIIT class?
Right.
But it's mostly cardio stuff. And I have to, and I'm in my 50s, I have to create an exercise program that is lifting heavy things.
Yeah.
And so it's good to do the cardio, and I have kind of revamped from, instead of 45 minutes of cardio, I'm going to do 20 minutes of cardio and 35 minutes of lifting.
There you go.
And really, like, anything that makes you sore. If your muscles are a little, it could be resistance bands. It could be weights. It could be floor exercises where, you do push-ups until your arms want to give out.
Right.
So many ways that you can build muscle.
Yeah.
But if you are on this weight loss journey and you would like to not only be successful in the loss, but in the maintenance, you got to be building muscle.
Yeah.
And you're going to be losing a lot of muscle, and you got to build it back.
And that's, when you're talking about resistance training, it can be body weight, it can be air squats and lunges and things like that. You build muscle by tearing it down through exercise and then getting that adequate protein and other nutrients. And when those muscle fibers heal, they become larger. again, depending on how much protein and your testosterone levels and your gender and all that stuff is going to depend on how big can I get.
Yeah.
But
and when people say, I don't want to look like a man, actually, you're not going to look like females. You're not going to look like a man, just like Michael said. But what I do want is I want to be able to eat food and not gain weight.
Right.
And when you have muscle, it burns more at rest.
Efficiently, yep.
And you can have a higher resting metabolic rate because of your muscle. So not only are you going to be healthier and you're going to age healthier, but you're going to be able to maintain your weight loss better when you have more muscle mass, when you have lean mass.
So I'll just get you a weight vest that you can put on while you're running.
There we go. And I can do my cardio with some heavy weights on. I'm sure you will help me to not be on a walker in a year. I appreciate that.
Absolutely.
So we talked about a little resting metabolic rate and ways that you don't regain your weight by making sure that you're exercising throughout, learning good food habits.
Right.
And you also talked about eating protein.
Right.
So not only is that going to help you to keep your lean mass and not lose so much lean mass, but proteins help you feel full, and most of us have too little protein in our diet.
Right.
So while you are on the tirzepatide or semaglutide, add more protein and be building muscle, and make sure that you are really looking at your macronutrients.
Right.
Take out your refined sugars, and you can reduce carbs. Our American diet has way too many refined sugars. And so if you are in those habits, when you come off of the medicine, you will not feel as hungry. Eat the things that help you. Eat fibrous foods like crunchy fruits and vegetables, high fiber. And those will help you feel full, so you don't need the medicine to help you feel full as much.
And then one more tidbit about the diet thing is when we eat a lot of starches and sugar and things, you get these big rises and falls in your blood sugar. So when you start eliminating some of those, and then you're eating with adequate protein levels, it's going to help stabilize. You don't get the big, rises and falls in your blood sugar. It's more stable, so you tend not to crave sugars and starchy carbohydrates. Listen, I love bread and pasta and rice and stuff as much as the next person.
Yeah.
And they're not inherently evil. You can still certainly eat those things and be healthy. But it's just learning how to manage them. So.
Yeah. Yes. And when you have those sugar drop-offs because you just drink that sugary drink, your insulin spikes, and then you have a sugar drop-off. Your body's trying to stay alive by telling you to eat sugar. And you start doing all that sugar craving, and it becomes really hard to maintain your weight.
Well, then your brain decides that, like, hey, I like this sugar stuff.
Yeah,
so,
that's exactly right. And sugar is very habit forming.
Yeah.
It does make those craving centers fire.
Yeah.
We've started a maintenance program. What we want to do here is help people to get to a healthy weight, but then we want to help kind of offer them some resources to maintain that weight, because we know maintaining is difficult. There's not a lot of research done by the pharmaceutical companies about how to come off of their drugs or how to be successful off of their drugs. Because believe it or not, they'd rather you buy them.
Shocker.
Yes,
can't believe it.
Exactly.
No,
And so we're having to, just kind of use our own brains, and there's not a lot of research that we can use to base these things on. But we've played around with some different ideas of how we can help people maintain. So talk to us about some of the things we're doing in our maintenance program.
Sure. So we have two maintenance programs. One is for semaglutide. One is for the tirzepatide. The way that they are constructed now is with semaglutide, we do 0.5 milligram, every other week. So twice a month, every 10 to 14 days. And what that does is allow you to, 0.5 milligram is kind of a lower dosing tier. So it mitigates some of the side effects and things. But it also allows you, like you were saying earlier, you've learned these new habits and things. And so if you come off the medicine and you start to regain weight quickly, that maintenance program, that 0.5 milligram every couple of weeks can kind of help mitigate some of the overeating, or if there were issues with insulin resistance. Let's figure out how to finesse or really optimize your diet and activity to help with that, so that if the ultimate goal is to come off of it, great. And then tirzepatide is the same. It's 5 milligrams. So again, one of the lower dosing tiers every 10 to 14 days. And so that's how we have it structured right now.
And some of our rationale and reasons for doing this, if you were on a higher dose and you've been on a higher dose for a few months, then you've gone from really feeling a good amount of the medicine to nothing. And you can really feel the absence of it more. So this is an opportunity for us to kind of titrate the medicine down. You're getting a little bit of the food noise back, a little bit of the hunger, but not as much. So what we're hoping is that you'll be able to use this to manage the little bit of issues that are coming, and it won't feel so overwhelming to have to manage all the food noise and all the hunger, and wow, I was really here and now I feel like I'm in such a different place. We've done it at, these are every 7 days as they are prescribed, but we've said, what if we take it to 10 or 14 days? Because we want you to have those few days where the medicine's out of your system.
Right.
We want you to be able to start feeling what that feels like again. And so that okay, toward the end of the 2 weeks, I have to have more self-discipline.
Right.
I have to recognize that this is what it feels like to feel hungry, and that's okay.
Right.
Now let me go make a smart decision
Right.
about my hunger. Let me eat some carrot sticks. Let me eat an apple.
Right.
Or if I do these kind of things, I can help balance that hunger.
Right.
So we're trying to help you balance your life skills with some of those things, but not have it hit you so hard and regain your weight fast,
Right.
or feel like, oh, this is overwhelming.
Right.
And so we want to give you just enough medicine to where it makes it easier, but to where you're still having to do some work.
Absolutely.
If a person says, I just want to see if I can go without, is that an okay thing? And then if they fail at that, can they restart the medicine?
Sure. I've had plenty of patients who, took the medication for whatever duration, lost the weight, they want to come off. Hey, I'm going to do this lifestyle, and they start to regain and come back after 1 month, 3 months, 6 months, whatever it is. And you can actually, you can absolutely restart on the medication. I would say that if it's been a while since you've been taking this medication, say you were on the highest dose of semaglutide, 2.4 milligrams, it's been 3 months, I would not start you back on that highest dose because,
you need to retitrate.
Yeah. So that's sometimes a misunderstanding or patients get confused and frustrated. But that is to help mitigate some of those side effects and things that can happen.
Your body becomes naive to it again.
Right.
And so it's not like, well, I tolerated 2.4.
Right.
Well, you may have tolerated it because we stepped you up to that tolerating.
Right.
And so we would not recommend that you just jump in at the high dose if you've been off of it because you get naive to it again. But there's a lot of different approaches and a lot of different thoughts, and we could probably get in a very controversial conversation about when do you use these prescriptions? Is it when people are overweight? Do you wait till they're obese? Do you wait till they're morbidly obese?
Right.
And I do think that it's appropriate to help people to, I like to treat people's A1Cs when they're becoming a diabetic.
Sure.
I don't wait to have this conversation until after.
Right.
I treat obesity as a chronic progressive disease the same as hypertension and diabetes. When your numbers are creeping up, I want to get involved. I want us to get control of it before it gets out of control.
Yeah.
And so I think it's perfectly appropriate for people to say, I'm going to try to do this myself. I don't want to be on these medicines. And when you gain 5, 10, 15 pounds back, is a great time for us to be having the conversation about what we can do. Is it lifestyle? Is it, prescriptions again for a period of time to get that weight back down?
Right.
It is not good for your body to swing 80-pound gain, 80-pound loss. And so I don't want to meet you after. You don't have to undo all your progress before we're on your team.
Don't wait.
Don't wait. And so you can go on and off of these medicines. We do this with diabetics as well.
Absolutely.
Can I take you off of your prescription when your A1C is at goal and you've made lots of lifestyle change and you've lost weight? We'll certainly try it.
Absolutely.
And we'll watch your sugars at home. And if the sugars are creeping up, then we go back on the prescription.
Yeah.
And if the sugars are doing great because you're doing great and you're controlling it, can you diet control it? Absolutely.
Right.
So, and then when that's not working, we have a conversation about going back on the medicines. And so, yes, you can come on and off the medicines. You can use lower doses of the medicine. You can space the shots out further than 7 days and see how you do with that.
Yeah.
I would love to say that the lowest dose of medicine that does the job is what we want to do in more than just this medicine.
Oh, absolutely.
If we can do life without pills and life without shots, that's better.
Right.
If we can do less, that's better. But we want to do whatever's necessary to help people be in their healthiest state.
Absolutely.
And so can you come off of these medicines? Well, the answer is still, it depends. But if you're on the medicines and you're doing the right thing, then the answer much more leans toward yes.
Right.
If you're off the medicines and you're doing the right things, the answer will probably remain, yes, you can stay off of them.
Right.
If life gets rough and you regain some, then you can go back on.
Yeah.
But I do think it's important for people to realize that these prescriptions, although excellent for weight loss, tirzepatide and semaglutide are not your substitute for lifestyle change.
No.
And if they are all you're doing that is making a change, then we promise you when you come off of them,
right,
you will gain the weight back rapidly.
Right.
They're not magic, and they don't get you to skinny and then keep you at skinny without taking the medicines. So if you make the right choices while you're on them, and they can help you to make those good choices, then the odds of you being able to come off and stay off are much better.
And I think that's why, when you're talking about making right choices, I think that's why it's important to work with somebody, clinical experts, whether we're talking about nutrition or, finding your personal trainer or your physical therapist or somebody that can help you in the movement space and working with that team to get those programs in place so that if the ultimate goal is to not use the medicine, you're set up for success. So.
Absolutely. Well, thank you so much for chatting with me on this, Michael. This is a topic that we're both super interested and passionate about. And so we hope that you've heard something today that is of service to you. And we ask that you join us again for our next Between Two White Coats. We like to leave you on a good note. So today's Tell Me Something Good is brought to you by our great friend and employee, Vanessa, who is one of our Wellness Co-Coordinators. Vanessa, tell me something good.
So my Tell Me Something Good is my son Caleb is celebrating a milestone this year. He is graduating from the 5th grade and will be moving on to middle school in the fall. And my husband and I could not be more prouder of his accomplishments.
And we have sons the same age about to happen in our family too.
Yes.
So bittersweet. They're growing up.
Up. I'm not ready.
Yes, but that is definitely something good.
Yes.
Thank you so much for joining us today. And until next time, take care of yourself.